I am very confused. Can someone explain to me what is the difference between MD and DO?
I love she goes on to ask, like, what is the beef between MDs and DOs? And to a certain extent, I honestly don't know. Hi, I'm Dr. Bryce. I'm an OBGYN resident and mom of 5 in West Virginia. I also happen to be a DO. And really, for all intents and purposes, there is no difference. Like you've noticed, we do the same residencies, we have the same education, the same training. There are good DOs and good MDs. There are bad DOs and bad MDs. Like it's all kind of the same. And for me personally, when I was a nurse, I had no idea who was who was allopathic trained versus osteopathic trained. It didn't matter to me. So for all intents and purposes, there really isn't. But what it comes down to is the history and basically a lot of chips on some people's shoulders. I don't want to offend people, but in my experience, it tends to be older white men on both sides that sort of hold this grudge between the two. Whereas for the most part, younger physicians who, especially since the merger of the two residency programs, it really hasn't mattered. So MDs used to be grumpy because DOs had their own residency, and DOs could apply to DO residency, and then if they didn't match, then apply to MD residency. So they were a little salty because DOs got 2 chances and they weren't as good because there was a period of time, and even to this day, the average MCAT and the average GPA of students matriculating to DO schools is slightly lower than our MD colleagues. Not by a lot. I think when I looked it up, the average GPA overall was like a 3.5 or a 3.6 for DO schools, and it's about a 3.7 for MD schools. And then your MCAT score was something similar. It was like a 5.06 to 5.08 for DO schools and 5.08 to 5.10 for MD schools. So again, very comparable. Just for the record, my GPA was higher than both MD averages. So it didn't matter. I still ended up at DO school. DO schools also tend to take a more holistic view of students. So applicants like me who are non-traditional tend to get more interviews and more opportunities at DO schools compared to MD schools traditionally. Although, again, all of this is changing. There's been a lot of, I would say, improvement in the application process more broadly. Additionally, just generally fewer people are applying to medical school, so the acceptance rate is going up. It used to be like 2% of people got accepted in medical school. Now it's something closer to like 40 to 50% of people get accepted in medical school. So there's a lot of flux and change right now in medicine. But essentially, it's a bunch of people who have chips on their shoulders for various reasons that there's really not a good reason for the beef. And what you'll notice is that for the most part,